storyline hits home hard for millions of Americans who can relate to being robbed of a loved one because of the disease.
And that's why some doctors and researchers have made it their mission to not just find a cure, but to actually stop Alzheimer's before it even starts.
WESH 2's Meredith McDonough takes us to one of these medical trials happening right here in Central Florida.
She didn't have that problem, but they both died of Alzheimer's.
Chuck Gear becomes emotional when he talks about his mother, Pauline. She died 2 years ago from Alzheimer's disease.
There's 6 stages of Alzheimer's, and the last stage is where they don't eat, and she went through that for several months, and finally she wouldn't eat at all.
Chuck and his wife Joanne have been married for 32 years. They have 5 children, 10 grandchildren, and 4 great-grandchildren. They have a lot to live for, and after seeing Chuck's mother and stepfather decline and die from Alzheimer's, both Chuck and Joanne made a decision. They came to K2 Medical Research in Maitland to have a diagnostic blood test. Chuck was not showing signs of dementia, but because of his family history, wanted to find out more.
Chuck has been with us for 4 months now.
Dr. Brandon Lennox has been doing clinical research for more than 20 years. His focus is on our aging population.
30% of all elderly patients will die of Alzheimer's disease, which is remarkable. And it's really become sort of the pandemic of our time.
Dr. Lennox explains this clinical trial is in phase 3, the last phase before FDA approval.
Now, there are 2 of the first prevention clinical trials in the world taking place. Both of those trials we're working on here. And it's focusing on patients who are at risk and identifying those patients who are at risk before they have that first symptom.
The key to this trial is a simple blood test that will identify proteins that may lead to Alzheimer's down the road.
These 2 proteins form in the blood in the late 40s, early 50s. And they slowly over time, over a decade or 2, bind to the brain and create plaques. The development of the diagnostic blood test and the focus on prevention is really changing the approach and really revolutionizing our approach to Alzheimer's disease.
Chuck and Joanne both took the blood test. Chuck has the protein that may lead to Alzheimer's and is now receiving treatment as part of the clinical trial.
We decided to go in on the drug study and health trial, and so yesterday I had my 4th infusion, and I feel fine.
We identify patients who are at risk with those proteins, and we put them on treatment with a monoclonal antibody that prevents the formation of those plaques on the brain, and ideally prevents that first symptom from ever occurring.
Chuck and Joanne are holding on to hope that this treatment will save his life.
I hope to live to 120 and not get Alzheimer's.
If it can help us slow down the process or learn how to deal with it better or anything that will help.
I don't want to get Alzheimer's, and of course I wouldn't know it. And but I wouldn't want to put it on her, burden on her or any of my family.
Meredith McDonough, WESH 2 News.
Yeah, I don't think any of us want that. Dr. Lennox says these clinical trials can last 10 to 15 years. The good news, the doc says, they are in the latter half of approval for these prevention studies. Anyone over the age of 55 can participate in this trial.